Thanks so much for joining us for this town hall tonight. I'm Barbara Ferrer, the director of LA County's Public Health Department. I'm joined by Dr. Davis, the LA County Health Officer, Dr. Terashita, the Associate Director of Acute Communicable Disease Control, Dr. Kurian, the Regional Health Officer for Service Planning Areas 1 and 2, and Dr. Kim, the Chief of the Education Sector Exposure Management Unit. To start, I want to tell you a little bit about how the town hall will go. We'll begin with some brief remarks from our panelists and then spend the rest of our time answering your questions. As a reminder, you can send in your questions in the chat on YouTube, Facebook, or Twitter. And thank you for those who have already sent us their questions. As displayed at the top, we also have live translation services during our event tonight. Para escuchar en español, por favor, marcas 888-664-1453. For Mandarin, 888-664-1459. For Korean, 888-664-1454. Before we move to opening remarks from our panelists, let me share the most current information on the COVID-19 pandemic and just give a little bit of detail on our post-surge response plan. I am grateful that LA County is now post-surge and transmission of COVID has slowed down. These recent improvements in our case, hospitalization, and death rates allowed us to make sensible changes to our mitigation strategies, guided by a post-surge plan that's anchored in both the states and the Centers for Disease Control and Prevention's updated COVID-19 frameworks. Centered to our work is the need to continue to focus on reducing the risk of COVID-19 for all residents and to narrow the gaps that leave some communities and residents significantly more vulnerable to COVID-19's harmful effects. This is especially true since transmission, while no longer super high, is at a substantial level with on average over 1,000 new cases a day. Today, we reported about 864 new cases and 34 people passed away. As of today, our 7-day average case rate is about 9 per 100,000. At our last town hall during the surge, our 7-day daily case rate was more than 31 times as high. The 7-day average daily test positivity rate has also declined to slightly under 1%. And that's, again, very different from the beginning of this year when 1 out of every 4 tests were positive. Hospitalizations are also declining, and today we're reporting about 500 people currently hospitalized with COVID-19. I know you all remember when at the peak of the surge, we had almost 5,000 people in the hospital each day. Our post-surge efforts are being guided by a post-surge response plan, which has 3 core components to it. We use a set of indicators that are determined by the Centers for Disease Control to reflect risks to the healthcare system, and those are tied to community prevention strategies. We've also created what we're calling an early alert set of signals that trigger a review of contributing factors and the potential to realign our prevention strategies. And we have a post-surge preparedness plan that will help us respond appropriately to signs of a possible surge or a new variant that might spread more easily, cause more severe illness, or evade vaccine protection. The CDC's new methodology assigns risk levels based on a combination of 3 metrics. The first one is something we're all familiar with, looking at case rates for the past 7 days. When determining the community level risk, CDC first determines whether the county had fewer or greater than 200 new cases per 100,000 people over the past 7 days. As of today, LA County's case rate is 89 new cases per 100,000 people. The next 2 indicators are hospital metrics, and they serve as a proxy for the level of strain on our healthcare system. The first of these indicators is the 7-day rate for new COVID-19 hospital admissions. Today, that's 7.2 admissions for every 100,000 people. This meets the CDC criteria for low community risk level. The second of these indicators is the 7-day average for the proportion of staffed inpatient beds that are occupied by COVID-19 patients. This is now 4% for LA County, which is also at the low level of risk. It's important to note that our designation as low by the CDC doesn't mean that there is a low rate of community transmission, nor does it reflect personal risk. Rather, it signals that we've successfully reduced the pressure on our healthcare system. This is why we also track a set of early alert signals, and that allows us for the early identification of issues in LA County that may indicate the need for us to realign our strategies to slow spread or to contain outbreaks. So in LA County, we're monitoring 7 early alert signals. They include 3 community-wide measures. We look at variants of concern, we look at emergency department COVID-19 visits, and we look at the cumulative crude case rate in our high poverty communities. The signals, these early alert signals, also include 4 sector-specific measures. We look at new outbreaks at skilled nursing facilities. We look at the number of new outbreaks at our TK through grade 12 school classrooms. We look at new outbreaks at settings with people experiencing homelessness, and we look at clusters at work sites. If our community-wide measures reach a threshold for moderate or high concern, we'll conduct a review of the factors that we think are contributing to this high threshold, and we'll consider some changes in our community prevention strategies. With our sector-specific alerts, if they reach the threshold for moderate or high concern, we'll implement mitigation measures that are tailored to that particular setting. So for example, if we had a metric that said that there was either moderate or high concern with school outbreaks, we would work with schools to introduce a set of recommended actions that schools could take to try to reduce in-school transmission. These metrics are really designed to help the county as a whole monitor our levels of risk and transmission so we can both maintain an accessible healthcare system for everyone, but also keep each other safe during the different phases of the pandemic. It also makes sense for each of us to take a moment to assess our own level of risk and the risk of those we live with and work with. COVID-19 hasn't gone away, and there are still many people within our county that remain vulnerable for serious illness. I know that Dr. Davis is going to provide more details on how we can assess risk in a moment, and I want to thank everyone for joining us here tonight. We do look forward to answering your questions, and now I'm going to turn it over to Dr. Muntu Davis, the County Health Officer, for updates on our most recent Health Officer order.
Thank you, Dr. Ferrer. Good evening to everyone who's joining us today. I'll be providing more information and updates on the recent changes we made to our health officer orders regarding masking in indoor public settings. I want to start by going over 2 big changes. As Dr. Ferrer mentioned, we're several weeks out from the end of our devastating winter surge, and LA County metrics continue to improve. And although community transmission remains substantial, the impact of COVID illness on our healthcare system, as indicated by the CDC, remains low. And as we think about the post-surge strategies to minimize COVID-19 risk as our metrics improve, I want to note that we've remained open during this very devastating surge because we used several protective measures that help diminish the impact of the Omicron variant of this virus. One of the strategies was masking. Masks continue to provide an essential layer of protection for everyone, especially when community transmission is substantial or high, and it helps reduce risk of exposures and drive down case numbers. Substantial or high transmission can lead to severe social and economic disruptions due to staffing shortages, reduced economic security, disruption to education due to missed days of school, and higher illness and death for those who have more exposures and those who are at high risk for getting very sick or dying from COVID-19 infection. Because transmission and the impact on our healthcare system have declined significantly from the last winter's surge, we made some sensible changes. To start, indoor masking is now strongly recommended, but not required, for vaccinated and unvaccinated individuals in most, but not all, public settings and businesses. A few important notes about this change. First, businesses and work sites can choose to continue to require masking for customers and workers. Second, employers must continue to provide medical masks or respirators to workers who are in close contact with others, and I highly recommend workers continue wearing a mask while at work. And third, there are still several public settings where masks are required by state and federal regulations. These settings where masks are still required include public transit, transportation hubs, all healthcare settings, long-term care, adult and senior care facilities, correctional facilities and detention centers, all emergency shelters, heating and cooling centers, and homeless shelters. As we have emphasized throughout this pandemic, masks are one of the easiest things we can do to prevent COVID transmission, and they provide strong protection to the person wearing them, as well as to the people around them, including those who are at high risk of getting sick or dying from COVID-19. We, along with the state, do urge individuals, regardless of vaccination status, to keep their mask on in public settings until there is much less risk of exposures for those at high risk. As is the case for other mitigation measures, local jurisdictions may continue to institute more protective requirements than the state and the county based on local conditions. The health officer order also modifies requirements related to pre-entry vaccination or negative test verifications. Vaccine verification in healthcare and congregate settings is still required. Pre-entry vaccine verification also remains required for entry into the indoor mega events, with a negative test result as a substitute for those who are not fully vaccinated. To close, we're encouraging residents to consider both their personal and family's risk and the risk of those around them when making decisions about safety precautions to take, such as masking, gathering, getting tested, and getting vaccinated or boosted. Risk is determined by a variety of factors, and the following are characteristics that increase the risk of getting very sick, meaning you're more likely to be hospitalized, need intensive care, require a ventilator to breathe, or die from COVID-19. If you or someone in your household is not fully vaccinated or, if eligible, boosted, that will increase your risk. If you are or you live with or care for someone who is 65 and older or too young, meaning under 5 years old, to be vaccinated and boosted, that also increases risk. If you or your household members have one or more underlying health conditions such as cancer, diabetes, chronic kidney, liver or kidney disease, heart disease, HIV, certain disabilities, or are immunocompromised, among other conditions, that will also increase your risk. If you or your household members are in close contact with people at work, school, or another community setting who are unmasked, unvaccinated, or may be infected with COVID-19, that will also increase your risk. And if community transmission of COVID-19 is substantial or high, your risk is also increased. Those with more risk factors need to take more precautions and should always wear a mask in indoor public settings. Avoid non-essential indoor gatherings, especially if you don't know the vaccination status of the people there. Get tested before and after gatherings. And of course, if not already done, get vaccinated and boosted if eligible. Thank you. Now I'll turn it over to Dr. Dawn Terashita.
Thank you, Dr. Davis. I'm happy to be here this evening to discuss variants and how vaccines and boosters will help us keep our cases down. As Drs. Ferrer and Davis both mentioned, our numbers are decreasing and we are past the worst of our surge, which was fueled by the Omicron variant. Omicron is classified as a variant of concern because it showed the possibility of increased transmission. And we saw that here in Los Angeles County over the past several months. Of course, we continue to track variants and subvariants, or also called sublineages, that may appear here in the county. Scientists and public health leaders continue to assess whether the Omicron BA.2 variant, when compared to BA.1, may spread more easily from person to person, lead to more severe illness, or become more resistant to treatments or vaccines. To date, there is information indicating that BA.2 is more easily spread, about 30% more infectious, but it does not lead to more serious illness. Among the 4 major Omicron sublineages that have been identified, the BA.1.1 lineage, which is a descendant lineage of BA.1, remains the primary Omicron subvariant in Los Angeles County. Since first identified in LA County, BA.2 has accounted for 231 sequenced Omicron cases detected here in the county. While BA.2 is slowly increasing in the county, it is still making up a very small proportion of all sequenced cases, accounting for almost 5% as of the sequence samples for the week ending February 19th. And I know there have been a few media reports about what is being called Deltacron, which is a genetic recombination of Delta and Omicron variants. We don't have any evidence yet that this is circulating widely or even in small numbers to know enough about what the implications might be. There can be issues with these variants, mainly knowing whether or not vaccines will provide protection. But again, with such small numbers, it's very hard to actually assess that. But knowing that there could be additional variants out there and they could be more infectious or deadly, it becomes even more important to get vaccinated and boosted. While COVID-19 vaccines are not 100% effective, they are very effective in preventing infection and even more effective in preventing hospitalizations. We see substantial reductions in cases and hospitalizations among fully vaccinated individuals and even more significant reductions for people who are vaccinated and boosted. For instance, unvaccinated people were about 4 times more likely to be hospitalized for COVID-19 when compared to those who were fully vaccinated but not boosted. When adding a booster dose, protection increased significantly. Those who were vaccinated and boosted were 9 times less likely to be hospitalized than people who were unvaccinated. The evidence remains compelling that reducing community transmission, hospitalizations, and deaths and preventing the strain on the healthcare system is best accomplished if more residents are vaccinated and boosted. Unfortunately, there are about 1.7 million residents who haven't received their first dose, and about 2.7 million booster-eligible residents who aren't benefiting from the extra protection of a booster dose. Given the importance of this booster dose, it is disheartening to see the drop-off in the booster coverage rates. There are gaps across all ages. Even amongst our highly vaccinated 65 and older population, only 63% are fully vaccinated and boosted. Given their elevated risk for severe illness, hospitalization, and death, it's important that we remain focused on increasing vaccine awareness, knowledge, confidence, and access for all residents, including older adults. One possible explanation for the low numbers of eligible boosted individuals may be related to the misperceptions that residents may have about booster doses, because being fully vaccinated doesn't include having received a booster dose once eligible. Many individuals assume that as long as you've received 2 vaccine doses, you don't need a booster. Unfortunately, because vaccine effectiveness for the approved COVID vaccines has been shown to wane over time, a booster dose offers the best protection, particularly against severe illness, hospitalization, and death. Another common misperception is that if we need boosters, this must mean the vaccines don't work. This isn't the case. Vaccines are effective, and for the first few months after being fully vaccinated, data shows that protection remains high. However, since protection fades over time, the booster dose extends the protection by fortifying your immune response to fend off the COVID virus. Some people may also think that being infected with COVID after they've been vaccinated gives them the same protection as a booster. Getting infected does provide immunity against future infections, but that protection fades over time and may not offer ample protection against variants. Recent data showed that immunity from a past infection from the Delta variant didn't necessarily protect from the Omicron infections. Because immunity offered by previous infection wanes, getting a booster dose is still a sensible step to take to maximize your protection. Another myth that we have heard about is that booster doses can make you sick with COVID-19. As with the initial series, it is not possible to get COVID-19 from the booster or the vaccine because none of the vaccines and boosters used in the US contain live virus that causes COVID-19. You certainly can experience side effects from the vaccine, but these are mild and are a result of the activation of your immune system. Finally, some people think that booster doses are recommended just so drug companies can sell more COVID vaccines. The recommendation to receive a booster dose isn't based on marketing. It is based on science. For COVID-19 and many other vaccines, you need several doses over time to stay well protected. Hopefully, as more people talk with their providers and trusted community leaders, they hear information that dispels some misperceptions. I know that there's a lot of information out there about vaccines, which can be difficult to sort through. If you have questions about vaccine or boosters, you can visit vaccinatelacounty.com and and vacunatelosangeles.com, or please call our COVID-19 information line at 833-540-0473 from 8 a.m. to 8:30 p.m. daily. Thank you, and I will now turn it over to Dr. Sarah Kurian to talk about therapeutics.
Good evening, and thank you, Dr. Dorashita. I'm happy to be here with everyone this evening to discuss access to COVID-19 therapeutics and then answer your questions. Earlier, Dr. Ferrer laid out the post-surge preparedness plan. Increasing the awareness of COVID-19 therapeutics, along with increasing their accessibility, is also a priority focus for our plan. While many people with COVID-19 have mild illness and can recover at home, others are at higher risk for getting very sick. Those who are at elevated risk for severe COVID-19 infection, hospitalization, or death may be eligible to receive therapeutics, which can help to prevent negative outcomes. LA County currently has 5 treatment options and 1 medication that is used to prevent COVID-19. All these medications must be prescribed by a healthcare provider. Some can be taken by mouth and are available from a pharmacy with a prescription or through clinical settings. Other therapeutics are given by injection or infusion. With the exception of remdesivir, supplies of these therapeutics are somewhat limited. 2 of the treatment options, Paxlovid and molnupiravir, are antiviral medicines that are taken by mouth to treat mild to moderate COVID-19. Paxlovid is for people ages 12 and over who weigh at least 88 pounds. Molnupiravir is for adults aged 18 or over. This medicine is not recommended for use during pregnancy and is only recommended if other treatment medications are not available. Both require a prescription from a healthcare provider. 2 other medications, sotrovimab and bebtelovimab, are monoclonal antibodies that are given by IV infusion. Remdesivir is an antiviral medication that's approved for inpatient and outpatient use for adults and children, including those under 12 years of age, who weigh at least 3.5 kilos or about 8 pounds. There's an ample supply of this therapeutic within LA County. The final medication, Evusheld, is not used to treat, rather to prevent infection. Evusheld is administered via injection and is available for people who have not been exposed to COVID-19 and can't get a COVID-19 vaccine for medical reasons. It's also recommended for people who may not respond well to a vaccine because they have a weak immune system due to a medical condition or treatment. Part of the preparedness work at hand is to expand partnerships with physicians and pharmacies. So once that there is an ample supply of all the therapeutics, there's a vast network of providers who can provide information and prescribe COVID-19 therapeutics, particularly in those communities with residents at elevated risk of poor COVID-19 outcomes. To date, public health has distributed nearly 70,000 courses of these life-saving medications to providers and facilities, with 64% of Paxlovid doses, 82% of molnupiravir doses, and 67% of Evusheld allocated to providers in the most under-resourced communities. I know there are a lot of questions about what medications are available and how to access these drugs. But the first thing everyone should know is that the medications to prevent and treat COVID-19 are intended for people who are at elevated risk for severe COVID-19 illness, hospitalization, and death, and must be prescribed by a healthcare provider. All the medications that have been mentioned can be given on an outpatient basis with a prescription. If you think you may be a candidate for one of these treatments, ask your provider if you're eligible. If you don't have a provider, request an appointment from a clinic that's part of the network of providers offering these therapeutics. You can get a list on our therapeutics website, which is at www.ph.lacounty.gov/COVID medicines, or on our Spanish language therapeutics webpage at www.ph.lacounty.gov/COVID medicamentos. If a provider indicates that you are eligible, you can also take your prescription to a participating pharmacy. Our website also has a list of the pharmacies where these products are available. The federal government also recently announced the Test to Treat program, which will allow patients to walk into local pharmacies that have on-site clinics to get tested and receive an oral antiviral medication on the same visit at the same location. Again, this is only if the on-site healthcare providers agrees that the treatment is in fact needed. If they've already been tested, residents can also bring their positive test to the site to receive the medication if the on-site provider recommends and prescribes treatment. At this time, about 20 CVS clinics with on-site health clinics or minute clinics are set to participate in the Test to Treat program in LA County. These participating sites are listed on our website. We continue to work on expanding this program, and additional sites will be added to our website as they come on board. Residents who would like to learn if they are eligible for treatment, access these medicines, or have questions on which treatment is right for them should contact their medical provider or call our COVID-19 information line at 833-540-0473, 8 a.m. through 8:30 p.m. daily. The call center is a free resource where residents can get information about available therapeutics and how to access them. Residents can also visit www.ph.lacounty.gov/COVID medicines or our Spanish language webpage at www.ph.lacounty.gov/COVID medicamentos. I look forward to answering your questions about these options in just a few minutes, but first I will turn it over to Dr. Kim to talk about school guidance.
Thank you, Dr. Kurian, and thank you everyone for joining us this evening. I'm here to share recent changes to our COVID-19 school safety guidance and the status of COVID-19 in schools across LA County. So last week, the state issued their new COVID-19 guidance for K-12 schools, and here in LA County, we updated our local school guidance last week on Friday to align with the state's recommendations. The biggest update was around masking in schools. So indoor masking has been required in schools since schools reopened last spring and into the 2021-2022 school year. Masking has remained as one of our most powerful tools to help protect children, teachers, and staff from COVID-19, to reduce outbreaks at schools, and to limit disruptions to in-person learning. With the lower COVID-19 case and hospitalization rates in our community, the update is that wearing masks indoors at school is no longer required, but now strongly recommended for students, teachers, and staff on school campuses, regardless of vaccination status. We are allowing schools to set their own policies for masking recommendations and requirements at schools, and are fully supportive of schools that would like to continue requiring indoor masks at their schools, along with other safety precautions for their school community. Given the strong recommendation for indoor masking to continue at schools, at the state, and here at the county, and the reality that there are persons in schools and in their communities who remain at elevated risk for COVID-19 disease, some schools may opt to continue to require indoor masking until community transmission levels reach lower levels. In LA County, where schools where masking has become optional, we do ask that information about the importance of masking is shared with every member of the school community, and that schools support all those that want to wear a mask to ensure that these individuals don't feel any stigma or any negative consequences from wearing a mask at school. Another update in the state school guidance was around isolation and quarantine requirements for TK through 12 schools, and we have aligned with those changes fully in LA County. As schools have done before, they must continue to require students or staff with COVID-19 to isolate at home to prevent spread at school, and a negative test will be required to exit isolation at 5 days after the positive test. If there is a COVID-19 case at school, schools are still required to notify persons or groups that had an exposure with the infected person and provide guidance on what to do next to manage their exposures. There are two options for managing COVID-19 exposures at school. One option is called group contact tracing, and this allows for a rapid and broad response for students who are exposed to an infected person in an indoor airspace at school. So for example, a classroom, a locker room, or a school bus. With this approach, schools notify groups of exposed students, such as classmates, teammates, or cohorts, of the potential exposure, And then students in this group may remain in school provided that they have no symptoms. So they are not required to quarantine. Although it's not required, we also strongly recommend that all those in the exposed group be tested 3 to 5 days after their last exposure and wear a well-fitted mask for 10 days after the last exposure. This group contact tracing is really the preferred approach for managing school exposure because it will keep more children in school, which is our primary goal, and it will minimize disruptions to in-person learning. However, schools can still opt to conduct individual contact tracing if they would like, which is the more traditional approach for identifying individuals with a true exposure to an infected person. Under this approach, students who are identified to have had an exposure at school and are not fully vaccinated must quarantine at home for 10 days after the exposure, but they can be released early from quarantine and return to school on the 6th day, provided they test negative and have no symptoms. There is an option for students that fall in this group to stay in school during their entire quarantine period under what we call a modified quarantine approach, if they meet certain criteria. These criteria are that they must have had a mask-on-mask exposure at school. This means that both the infected person and the exposed person were masked during the exposure period, and the exposed student doesn't have any symptoms. So students who meet these criteria can remain in school and participate in all school activities, including sports and extracurricular activities during the entire quarantine period, provided that they remain symptom-free. They are also strongly recommended to wear a well-fitted mask around others in school for 10 days and test on or around day 5 after exposure. I also want to mention that while the newest guidelines are centered around masking, masks are just one tool we have in preventing children from getting seriously ill. As of March 14th, so just a couple days ago, only 35% of our youngest school children aged 5 to 11 had received one dose of the COVID-19 vaccine, and 30% were fully vaccinated. So these rates are very low. Among the older children, aged 12 to 17 years, we are doing much better with our vaccination coverage at 85% for one dose of vaccine and 77% being fully vaccinated. So our COVID-19 vaccination data have shown how powerful they are. Unvaccinated children ages 5 through 11 are 2 times more likely to be infected when compared to those who were fully vaccinated. For those children aged 12 to 17, unvaccinated teens were 2.5 times more likely to be infected and 5 times more likely to be hospitalized when compared to those who are fully vaccinated. To make it easier for children to get vaccinated, Public Health is working to make vaccines widely available at many school sites. For the month of March, we have 921 school vaccination sites that are scheduled, with 86% that are located in our hardest neighborhoods. And this includes South LA, Southeast LA, the San Fernando Valley, and areas in Antelope Valley. So we encourage you to check with your child's school to see if the COVID-19 vaccine clinic is available, and also visit our vaccine website to find a location near you at www.vaccinatelacounty.com or www.vaccinatelosangelescounty.com. Thank you. And now back to you, Dr. Ferrer, so we can start taking questions.
Thank you so much to all of our panelists. Those were great presentations. I think they were really informative, and I hope provided folks with enough information that you now have a whole bunch of questions. We did already get a lot of questions in, dozens and dozens, so we're going to get started. And just as a reminder, you can continue to send us questions. If we don't get to your questions, we try to go ahead and collate all the questions that came in and provide answers to the themes where people are requesting additional information. Dr. Davis, I'm going to start with you. We know there's a seasonal aspect to the outbreaks and surges. So what are the plans to boost vaccination rates, especially booster shots, to prepare us for the possibility of a summer surge, which is likely to start around the beginning of July?
Thank you, and that's a great question. It's something we continue to work with, along with other healthcare providers and healthcare facilities, as well as our community partners, in order to provide education, continue to answer questions from people about the COVID-19 vaccines, as well as helping people get all of the recommended COVID-19 vaccine doses that they're eligible for. We also continue to support mobile vaccination sites to improve and ease access to the vaccines, but it'll be a constant in terms of continuing to provide education, answer questions, and ensure that access is easy for people to get the vaccines.
Thanks so much, Dr. Davis. Dr. Terashita, these are great questions, so thanks so much to everybody who sent them in. What is being done to ensure that we have an accurate count of new cases, given the availability of at-home tests that aren't necessarily reported to anyone?
Yeah, thank you for that question. And this is something that we are actively dealing with because it's changing quite rapidly. We are very pleased with the increase of the availability of the home tests. Home tests provide a way for people to get tested and know if they have COVID very rapidly, low cost, and convenient. It's a good way of not exposing yourself to others in a healthcare setting if you can take a test at home. But of course, as you mentioned, as the question mentions, it is difficult for us to track these tests, as there is really no way for public health or the health department to know when people are positive with a home test. So to ensure we measure what's going on in our community, knowing that there's a lot of home tests being done, we've really had to shape and reshape what we are doing as far as metrics. And Dr. Ferrer mentioned the new metrics that we will be following moving forward. We created them with guidance from both the state and CDC to focus on some of our high-risk communities, some of our high-risk sectors, as well as protect our healthcare system. Thanks for that question.
Thank you so much, Dr. Terashita. Dr. Kurian, how quickly were the new COVID therapeutics made? Are they based on years of research like the vaccines? Do you think they're safe?
Good question. So these medications were made very specifically to address COVID-19, but they're not new in the way that they work. So we do have two main types of medications. So right now we have antivirals and antibody treatments. The antivirals really work to prevent the virus from replicating in our body, which is how many of the other antivirals that we have for other infections work. The antibody treatments mark the virus for destruction by the body's immune system, which is also similar to how other antibody treatments work. So Paxlovid, Molnupiravir, and Remdesivir, which were some of the medications that we mentioned earlier, are all antiviral medications. And so Trivimab and Bebtelovimab are antibody treatments. And all of these medications, with the exception of Remdesivir, are under emergency use authorization. So they continue to be evaluated and monitored by the FDA for both safety and efficacy. And as any issues come up, the FDA would notify us either of needing to modify our use of the medication or stop using. So for example, as we started seeing sort of an uptick with Omicron, there were a couple of monoclonal antibodies that the FDA actually recommended stopping use of because they weren't as effective against that particular variant. So they do keep a very close eye on the continued efficacy and safety of these products.
Dr. Kurian, just maybe a follow-up question. It seems like we've had antivirals, however, for other illnesses, and we've used antibody therapies for other illnesses as well. So is the science behind both of these types of new treatments something that we've had a lot of experience with? Because I think in part that was part of that question is, you know, is this a whole new way to think about a therapy, or do we have years of experience with other illnesses?
Yeah, and that's a good question. No, it is very similar to what we've been using in the past. So antivirals for other diseases have been around forever. So the class and type of medications that are being used for COVID are very similar to what we've used against other diseases. So that science and technology are they've been around.
Yeah, I think that's really important. I also, I just want to remind folks, while we don't have a lot of supply of some of the newer therapies, we actually have enough that people who are seriously at risk of illness, should they get infected, really should be talking to their providers. And, we can also help you. So please call us if you need help figuring out if you're eligible, if you need help finding a provider, if you need help getting the medication. Because right now we have medication that's just sitting on the shelves here. And we know that there are lots of people getting infected every day. So we'd like to make sure for those of you who have risk of developing severe illness, you're making sure you're talking to your provider or one of our providers about what might work best for you. We have a team of folks that can help answer some of your basic questions and really get you to a place where you can work with somebody should you be eligible for the medication. You could see we're going on a little bit about therapeutics because, people often ask us like, what's in the toolbox and, what do we see in the future? And one of the things we see in the future is if we have a lot of medications or even just a handful of medications, but we have a lot of supply, and they're medications that when people get infected, they can take to prevent them from ending up in the hospital, that will be really powerful. It's not as powerful as our vaccines are because that prevents you from really getting infected and also going on to develop any illness. But it is a good tool for us to have for people who are particularly at high risk of having a bad outcome. So we want to make sure that folks get their questions answered, know that even though there's some scarcity, we've got medications that are right now sitting on the shelf. So people who are newly testing positive, they just developed some symptoms, please either call us or contact your provider and get more information. Dr. Kim, I have a bunch of questions here about schools. Let me start with, I think, a question top of mind for many is, why did the county move so quickly to remove the indoor mask mandates, especially at child care, when children under 5 years of age are not eligible to get vaccinated?
Thank you, Dr. Freer. So here in LA County, we made the decision to align with the state's updated school guidance to lift the indoor mask mandates at school and daycares after Friday, March 11th, and instead strongly recommend indoor masking for all, regardless of status. So we, this was a state decision and we aligned with the state. The state did indicate that this decision was based on science, based on a review of epidemiological indicators and modeling projections. And typically these types of models include data points that include the infectiousness of a virus, the transmission potential, the transmission rates, hospitalization rates, vaccination coverage, the uptake of therapeutics and other indicators. But nonetheless, we know that schools and daycares will need to do their own risk assessment based on their local needs. And we fully support any schools or daycares that would like to continue requiring masking at schools and their daycares as part of their routine safety protocol on campus.
And I'd probably add just a couple of things that I think might be important. One is for children 2 to 5, they feel free to make sure they're going to child care sites with their masks on. If they're wearing their mask appropriately and they have a high quality mask, it does offer them as the individual wearing the mask some protections. Yes, masking works best if everyone in a setting they're all wearing masks, but they also do provide some good protection for the wearer, particularly if it's a well-fitting mask that does a good job filtering. So that for children, KF94s come in children's sizes. So, go ahead and look into that. The second thing I want to note is we did align with the state. We generally try to align with the state. We know it causes less confusion, but we've also been crystal clear that we are watching very carefully what's happening at daycares and what's happening at our schools. And if we think that there's too much transmission and it's creating unnecessary risk, we will reevaluate that guidance and could in fact then come back and say, we're still seeing a lot of transmission. We're now seeing more transmission at schools as opposed to just in the community. We see more outbreaks, and we could come back if the situation warrants it and reverse our decision and go back to requiring people to wear masks while they're indoors at these sites. But we would base that, as Dr. Kim noted, on our science, on our data. Whenever we see a lot of risk in LA County, we share that information with everybody so that everybody has the same exact information we have, but then we do use that information to guide us. Our hope is that people being more careful, lots of people, we say everyone keep your masks on in these sites when you're indoors. We're not hesitating at all to say when we strongly recommend that people wear a mask, that means keep your mask on. We went from telling people they had to do something to really asking people to do something that's best for everyone. And that's where we are. We're saying this is a really important layer of protection that everyone still needs when they're indoors among other people, workers or guests or students, because it provides a powerful level of protection while we still have substantial transmission across the county. So thanks for asking that question. And I appreciate also that lots of people have different feelings about this. Some people are very anxious to be able to make decisions for themselves and their family members. And other people are very worried about making sure that we're actually, being as safe as possible while there's still a pandemic going on. So I think Dr. Kim said it best when she said, we're going to have to be respectful of people's decisions. But at some point, if the situation changes, our recommendations will change as well. And I want to say that goes both ways. If things go really, really well, the language where we're strongly recommending that people keep those masks on indoors may disappear. But we're going to be guided, as always, by what we're seeing in the local data as we move through this post-surge period. I'm going to go back to Dr. Davis, if that's okay. Dr. Davis, considering the rising number of BA2 cases that we're seeing across the world in other countries, why are we lifting indoor mask mandates now? With most people testing at home, we won't have a case metric that's reliable to tell us that cases are really going up. So what would trigger us returning to telling people it's important to put those masks back on, or they're required to put those masks back on before it's too late to prevent another massive surge?
That's a great question. And, we've outlined a lot of what we'll look at post this winter surge in our post-surge plan. And in that, as Dr. Ferrer talked about, we have some early indicators which may raise our level of concern. And if we get to that high level of concern, that's where we would consider putting back the requirement for indoor masking. But I will say that as we continue to watch BA2 in LA County, in the United States, in the state of California, we are monitoring to see what is actually happening with it. We know that it is much more infectious than even the Omicron variant that we saw during the winter surge, which is why recommending masking is a strong recommendation. But as we look at things, as we look at the impact to our healthcare system, that would be another thing that might start to trigger concern and have us implement the requirement for everyone, regardless of vaccination status, to wear a mask again. But we'll continue to monitor it. But I do say look at our post-surge plan to really see what we're looking at. And that will give you some indication as to things we'll consider as we think about whether or not it needs to be implemented again.
Thanks so much, Dr. Davis. Dr. Terashita, again, this is a very well-informed public, and these are really brilliant questions that really reflect where we are right now and how many things have been changing. Given all the changes that have happened on people reporting test results, how is the county planning to deal with case interviews and contact tracing?
Yeah, that is something we are actively working on right now. As discussed before, the pandemic has lasted a long time. It's changed over time, and we, LA County, have changed with it. When we first started our case interviews and contact tracing, this was really an effort to get a handle on the disease. For every case, we wanted to know where they were exposed and where do we think they got infected, and then subsequently who they might have exposed and who they might have infected in a way to combat disease. Now, this is all still very important, but now with so many cases and so many contacts and a lot of immunity in the county because of either natural post-infectious immunity or vaccine, like we've really changed why we do case interviews and contact tracing. I mean, in LA County, we're very proud to say we've continued this process through the whole pandemic. We've learned a lot of great information and we've made a lot of great contacts. One of the things we've learned that has been very helpful to us is we provide a service when we contact cases and their contacts that need help. We are able to offer information, education, resources, and referrals as needed. So this is what we plan to do moving forward. We're starting a new, more automated system where we are sending automated emails and texts to smartphones where cases can complete interviews online. Simple. It asks a few questions that are really to get at the type of areas people are getting exposed and infected, and what their immunization status is, for example. And we will also offer contact tracing or contacting contacts for anyone who needs assistance. And this is something we plan to move forward very, very soon. In addition, we plan to continue in-person phone calls at our high-risk areas. These are areas of lower resources as well as low vaccine uptake. And additionally, we're doing something very special in the county where we are offering some field visits in some of our higher need areas. And this could either be areas that are more dense with infections or more lower resourced areas. So we're very proud to move this case interview and contact tracing into the future.
Thanks so much, Dr. Terashita. I wasn't sure, did you note that folks can also just call us if they test positive? We have a few questions that just came in. So I just want to note that, if you've tested positive and you have questions or you need help or you need a place to isolate from other members of your family, we do have a call center. It's open from 8 to 8:30, 7 days a week, 8 in the morning, 8:30 at night. People speak many different languages. We're really there to help you with anything you need. You have questions about what it means when you test positive. You want to know how long you have to stay home and away from others. You want to know when is somebody really a close contact and how do you know who are your close contacts and how do you figure that out? We're here to help you. So traditionally people thought of this as something we're going to always call you, but we realized for many people, they would just rather call us if they have questions and they need help. I don't know, Dr. Terashita or Dr. Davis, if you've got that number handy, or maybe it can just go up on the screen for a little bit so folks can go ahead and, give us a call. I mean, we can answer lots of different questions at that call center, but for people who have tested positive and you need to talk to us, you need some help, 833-540-0473. Again, that is 7 days a week. So we think it's a good resource as well, and we're hopeful that folks will feel very comfortable using that number. I'm going to just, there's a lot we could talk about here, and I appreciate all the questions about, what to do around the identifying cases, your close contacts. But for the people who wrote in that they just tested positive and they have questions about their case, could you please just give us a call? So we're not going to have time to get into everybody's specific questions about what they need to do, but if you give us a call, we'll help you out. And again, people are still there now and they can take your call right now if you've got some questions. I do want to go back to Dr. Kurian about some questions on the therapeutics. And this, I think, is a general question. What kind of underlying conditions would make me high risk and eligible, in particular for Evusheld, but also for other therapeutics?
So really good question. So just as a reminder for people on the call, Evusheld is a medication which we're using for pre-exposure prophylaxis. So it's really intended for people who can't be vaccinated for medical reasons, like they've had an anaphylactic reaction to a component of the COVID-19 vaccine, or because they have an underlying medical condition or are on therapy that really prevents their body from developing an appropriate response to COVID-19 vaccines. So for these folks, unfortunately, vaccination is really not enough. So the type of patients that really qualify for Evusheld would be people who, again, have either moderate or severe immunocompromise. So these are folks, for example, that are on active treatment for like a solid tumor or blood cancer, or they've had a solid organ transplant, or they're taking some sort of immunosuppressive medication like high-dose steroids. Or it could be people who have diseases, like I mentioned, that affect their immune system, like they have advanced or untreated HIV or AIDS. All of these medications do require individuals to have some sort of higher risk for developing severe illness. So other than Evusheld, the treatment medications really are aimed at folks, again, who have those underlying risk factors. So these could be things like being 65 and older, or people who have cardiovascular disease or kidney or liver disease, or might be people who are diabetic. They even look at things like, physical inactivity or other sorts of disabilities as potential risk factors. So again, if you feel like, you are in that category, and if you test positive and you're starting to have some mild symptoms, be sure to talk to your provider about whether one of these treatment options are really right for you. And if you have, moderate to severe immunocompromise, like we talked about, folks that are on cancer treatments, had a transplant, have an underlying immunosuppression, talk to your doctor now about getting on the pre-exposure prophylaxis medication Evusheld, so that you are protected from getting COVID in the first place.
Oh, thanks so much, Dr. Kurian. I know that was helpful, and there were a lot of questions about that. So hopefully we answered a whole bunch of people's questions that came in. Dr. Davis, I'm going to go back to, there's obviously lots of people very worried still about what's in store. And I'm going to try to summarize a set of questions about sort of the worry about the future. There are a few questions that came in about how do we understand what's going on in Europe and China? How are cases going up so much when so many people are vaccinated? And along with that, there's a question that I think you were talking a little bit about in your opening remarks, but again, we've got a lot of questions about this. If we end up seeing cases going up here, do you think we're going to go back to lockdown, or do we have other tools that may help us avoid needing to go to lockdown?
Lots of good questions and important ones. I do want to go back and give a little bit more detail just in terms of what we'd be looking at. And I think it's helpful to sort of give people an idea and answer this question as well. So when we talked about early alert signals, looking at the percentage of sequence specimens or positive tests that are a new variant of concern is what we look at. We'll also look at emergency department visits that are classified as coronavirus related. We'll also look at the case rate in our lowest income areas, which have always been hardest hit by the pandemic, as well as looking at outbreaks in some of our sensitive sectors like skilled nursing facilities, schools, homeless shelters or homeless settings, as well as work sites. Those are the things that we start to look at that may raise our level of concern. In terms of if we start to see what we're seeing in other countries, where hospitalizations are going up and cases are going up as well. At this point, I don't see us having a need to go back to doing a lockdown like we did before. Now, the one caveat in that is, if we don't have really effective vaccines, to say that's completely escaping vaccine protection and none of the medications start to work, then we're sort of back to square one where we don't have things to treat and prevent. However, as we've gone through this last winter surge, we did not close. We had masks in place universally. We had lots of testing available so people could find out if they were positive or not in order to ascertain their risk of spreading to others or whether or not they had it. So we'll always look at what tools are available to see what we may need to do. But when we were going into lockdown, remember, we barely had testing. We had no vaccines and we didn't have any treatments. So we're in a very different situation. So we've learned a lot over these 2 years. And so I think we may not need to do that given what we know and what we have now.
Thank you so much, Dr. Davis. Dr. Terashita, I'm going to flip a little bit to vaccines and boosters. There's again, a lot of questions here. I'm going to start with a question about a fourth dose of the vaccine or a second booster. There's some questions that came in, obviously, people watching the news very carefully, that both Pfizer and Moderna have applied to get authorization to offer a fourth dose of vaccine. Will that happen? How soon will it happen? Is it going to be restricted? Just some groups of people? There are a lot of questions about who should be getting a booster as well. So there's folks who didn't get their booster yet. They felt like, they had a good coverage with 2 doses. They then got COVID anyway. They don't really know why they would get a booster now. So I think, again, we talked a little bit about this, but I think just going back over, sort of what we know about the boosters and what may be coming in the very near future, as well as, what's happening with the booster doses for the 5 to 11-year-olds. Sorry, that's a lot, Dr. Terashita.
Oh, no, these are very important questions. And as the health department, we do think getting vaccinated and boosted is the most important thing you can do to protect yourself against COVID. So these are good questions. A lot of them I don't have answers to, unfortunately. There have been a flurry of questions about the fourth dose, or maybe I'll call it the second booster dose, because as Dr. Furr mentioned, the vaccine companies did file with the FDA for an emergency use authorization for this second booster dose. Now, I don't know when they will convene to meet, but it's probably going to be in the next month, maybe April we'll hear, and I really don't know. The FDA will be looking at all the evidence, safety, efficacy of another booster dose to see, if the population needs it, what time frame, what dosage, lots of questions, and we have to just wait. CDC has not commented. I assume they're still waiting also to see what the studies are showing. So more to come on the fourth booster dose, but it is a good opportunity to remind everyone, you need to get your booster dose. Like, there have now been enough studies that we can say with comfort that vaccine immunity wanes over time. It's very protective. It protects you against severe illness, hospitalization, and death, which are the most important things. But they wane over time, and there's a lot of studies that are coming out every day which are showing this. So we know that with a booster dose, you can boost your immune system. How long the boost coverage lasts is unknown, but it looks like it might be a period of weeks to months. And then the theory is another booster will boost you again. Again, we have to wait to see what the studies are showing, what the FDA decides, and more to come. And Dr. Furr, I wasn't sure, did I cover everything? Oh, the 5 to 11s. Again, very common question. Of course, 5 to 11s, you may know, have been authorized for a booster dose for those who are immunocompromised. That came in January. But for healthy 5 to 11-year-olds, there is no booster recommendation at this time. So that's
there's a parent who wrote and said, her daughter was vaccinated when she was 11. She's now 12. Can she go ahead and get a booster dose since she's now 12?
Oh, very good question. Yeah, it happens to a lot of people because everyone continues to age. The rule for vaccine is you follow the vaccine at the age you are. So when she was 11, she would get the lower dose of Pfizer vaccine. But when she turns 12, she is now in the category she needs to get the full dose. So she would need to get the full dose of the booster vaccine. She needs to make sure that she's 5 months after the completion of the full dose series. But she should get the full dose at that time.
Oh, that's great. And I think we got to a lot of people's questions. So thanks so much, Dr. Terashita. Dr. Kurian, I think there's a set of questions again about the therapeutics in general. I think this is a really important one. So thank you to whoever sent this in. So the first part of it is just who do I talk to get those medicines if I know that I'm at higher risk? And then do I have to take it right away? Like, can I just get it so that I'll have it should I need it? So I think there are a couple of folks who wrote in about this. They know they're at higher risk already. Can they go ahead, talk to their provider, get the prescription, fill the prescription, and then just hold on to it until they actually need it because they had an exposure, they tested positive, and they are starting to have symptoms because they're worried that they won't get it in time. So I think this is a question that we understand your worry about this because there's a lot of steps that you might need to go to before you're going to get that medication. So Dr. Kurian, I'm wondering if you could just talk a little bit about that.
Sure. So maybe I'll tackle the first part about, who do I talk to get these COVID medications. So for those of you who have a healthcare provider, absolutely, again, check in with them and check in with them ahead of time. Find out if they have product in their clinic or if they would need to refer you to a pharmacy. And our website that we mentioned earlier has information on all of the both clinical and pharmacy sites that currently have a product on site. So, you can talk to your provider and they can, if they have medication available at their clinic, they can dispense it from their clinic. If not, they can write you a prescription and you can check the website to see which pharmacies near you carry the product. I would call the pharmacy ahead of time just to make sure that they have product. Most of our pharmacies across the county should have plenty in stock, but it's always a good idea to call ahead and make sure. And then, you can come in and, get your prescription filled. For those of you who do not have a healthcare provider, there's a couple of things that you can do. So on the screen, you see the 1-833-540-0473 number. You guys can call that number and our call center staff can help you in identifying a provider where you can get services. I will also say that we have on our website a new federal test to treat program, which we just got notification. It's sort of late breaking news that they are ready to roll. So there are 20 CVS sites that are listed on the website that are ready now to start seeing patients there. So if you don't have a healthcare provider and you are starting to get symptoms, you can go in and they do ask, especially if people are positive or symptomatic, to try and make an appointment online. If possible, you can walk in as well, but making an appointment just helps protect other people if in fact you are positive. So you can go to one of those CVS Minute clinics and get tested and be seen by a provider there who can determine whether or not you're eligible. And if so, you can get medication right from that pharmacy. So a couple of different ways in which you can try and access these medications. Now, once you are identified as needing the medication and your provider or the pharmacy or one of these test to treat centers gives you a prescription or hands you the medication, it is really important to start taking that medication right away because all of these medications are most effective as the sooner you take them from the start of your symptoms. So for example, Paxlovid and Molnupiravir, which are the two oral antivirals, are most effective and you have to take them, I would say, within 5 days of your symptom onset. So really important if you're high risk for getting really sick, to go in and get tested as soon as you start to see any sort of symptoms or think that you may be exposed or have COVID, so that you can get tested and started on medications as close to your symptom onset date as possible. The other thing I will just note, in case this is what people were also alluding to, these are not medications that you can just sort of pick up over the counter and hold on to for when you do become positive one day. It really is indicated for people who are at higher risk, who have tested positive, and who have mild to moderate symptoms.
Yeah, thanks so much, Dr. Curry. And I do think that last part was what the questions, can you buy these ahead of time for the just in case? And I'm glad you were able to say definitively, not a good idea. Don't hold on to these. You'll need to do that assessment with your provider when you in fact have tested positive. Dr. Kim, there are a few questions that came in again, and we so appreciate hearing from parents. Why do children have to wear masks at school for so long? I thought they really couldn't get COVID. And, along with that, there are questions about what would it take for us to go ahead and impose indoor mask mandates again at schools. So I think from both sides, some parents, I think, are really worried about masks because they don't think that children were getting sick with COVID. I think we should answer that and explain what we know about that, and then talk a little bit about how we would be making decisions about whether we need masks again at schools.
Great. Thank you, Dr. Ferrer, and thank you to those that asked those questions. So why do children have to wear masks at school for so long? As I mentioned before, we're really guided by our public health partners at the state and CDC, and California State required schools to have masks being worn indoors since the fall. And that was just lifted last Friday, and then we aligned with that. The comment about kids not really getting COVID, I really want to note that kids do get COVID. In fact, we've had approximately 140,000 cases of COVID-19 among school students since the pandemic started. That's not a small number. And as I had mentioned also, the unvaccinated students remains as one of the highest risk groups at school, and we need to protect them, as well as, unvaccinated individuals in the community. So as I mentioned earlier, if you are unvaccinated student, you are 2 to 2.5 times more likely to be infected than fully vaccinated students, and 5 times more likely to be hospitalized than fully vaccinated students. So there are some serious outcomes to kids that do have COVID. It is true that they don't get it as much as their adult counterparts, but they do get it. And that's why we had the masks on for so long, and we had such high community transmission rates that we did need to continue to protect those that are at highest risk.
I just want to also point out, during January, the month of January, we had over 250,000 children between the ages of 0 and 18 test positive for COVID. So it's a myth that children don't get infected. I think what is true is, as Dr. Kim said, they're much less likely to have serious illness, but that is no consolation to the families of the 10 children in LA County whose children have died from COVID illness. And it's no consolation to the hundreds and hundreds of children that have been hospitalized, and the dozens and dozens of children that have ended up with multi-inflammatory syndrome in children. So I think, again, this disease can be quite devastating, even for some children. And again, that's similar to other communicable diseases like chickenpox and measles. Many children may have mild illness, but some will not. And most importantly, all of those children that are infected have the potential, and some in fact do, go on to infect other people who are very vulnerable, other people that they live with, other people in the school environment. So this is really a lot about protecting each other still. I want to just note that the state had a requirement. We couldn't unilaterally lift it, but I want to be clear, we supported that requirement as well. I don't want anybody to think that here in LA County, we would have lifted the indoor masking requirement at schools earlier than the state did, because we wouldn't have. We supported that decision. It was made with a lot of science behind it around what was going on with high rates of transmission in the community that mean that at school, if you're not layering in protections, you can have too much transmission at schools as well. And that too much transmission at schools could end up closing some schools or infecting some people who are really vulnerable. So I think we all lined up with that, although I recognize there's been a lot of misinformation circulating about the fact that children really don't ever get infected. And hopefully you can look at our data, you could talk to friends and see that in fact children were getting infected, and especially during Omicron. But sorry, Dr. Kim, I know you were going to go on and talk about like what might make us return to masks at schools.
Sure. So Dr. Ferrer had mentioned earlier that we're monitoring several early alert signals. So we're looking at our data on a daily basis. And this is for not just for the education sector, but for various sectors in LA County. And you know, we like that because we are able to have more control over actually what is happening and the response. So the school or the education sector early alert is based on the number of school classroom outbreaks in the past 7 days. So every single day we look at our data and we monitor that. And there's several thresholds where there's low concern, moderate concern, and then a very high level of concern. So when that alert reaches a high level of concern, which is 15 or more classroom outbreaks in the past 7 days, we're going to be requiring schools to layer back in indoor masking among staff and students, as well as required testing for persons who are not fully vaccinated, both through a weekly screening program and through response testing for persons with an exposure. So we're really, using these early alerts to guide what our next steps are to get ahead of any sort of massive transmission, to be able to stop the chain of transmission in schools. And I do want to say that schools have really remained very, very safe. We've been tracking this since the beginning, and the level of transmission on schools is very low. The number of outbreaks that we've had at schools, which represent true transmission on campus, has remained very, very low. So, we are really confident that being able to layer these prevention measures in place when needed, we should be able to curb transmission when it gets to that point.
Dr. Kim, if you don't mind, we had another question that just came in a couple of minutes ago, which I think is important to try to answer as well, which is what happens at school when there's an outbreak? Does the Department of Health investigate? And what would make a particular school, have to shut down? And I just want to note, the Department of Public Health has not ordered any schools to shut down during this pandemic. So there's been a couple of schools that chose to close when they had a lot of cases, but none were ordered by us to close.
So this is a really good question. And, when there is an outbreak, that is concerning. That is, it is verified spread that's happening. So we define a school-associated outbreak when there's 3 or more cases at school within a 14-day period that are linked together through contact. So we call this epilinks, epidemiologically linked. And this means that they were in the same place at school at the same time. Well, at least one of those cases were infectious. So when there's an outbreak, so what happens is we require that schools report to us any clusters of 3 or more cases in the past 14 days, and someone then starts communicating, coordinating with the school to really verify whether or not those 3 or more cases are epidemiologically linked. And if they are, DPH opens up an investigation and responds to really diminish the spread. When that outbreak investigation happens, there's a couple of steps that the school can expect. There's this first initial assessment where the investigative group, they assess the information on the cases and the exposed contacts to see really what are the patterns, because every single outbreak is very unique. And so it's going to require a very tailored response. We are going to educate the site on what the outbreak management process is. We also post the outbreak on our website, and we feel that this is really important because we need to be transparent about our community outbreaks in LA County. So we post that on our website so that people can see where outbreaks are occurring. Then we plan for a site visit. Every outbreak has a site visit from our team. And the team then assesses, where are the high-risk areas? What does the ventilation look like? What does the classroom look like where this happened? And what are the site-specific strategies that are needed to prevent spread? And then we also look at, has the school complied with safety protocols? So we review this with the school officials. We make recommendations, we answer questions and concerns, and then we monitor. We track compliance. We see, we want to make sure that there's testing available for all of the exposed contacts. And then we want to track to see, is spread still continuing, or are we seeing a reduction in cases? And then, when there's 14 days that have passed since that last case in the outbreak on site while they were infectious, then that outbreak site qualifies for a closure. So we do monitor for at least 14 days, if not more. We confirm that that facility has implemented all of our recommendation on mitigation measures. And then we send a closure letter to school, and they're able to just close out and then continue on. So, I think it's just really important if your school, this is the way we monitor transmission. So if your school, if you think you have 3 or more cases that are linked, that school should contact us immediately within 24 hours to report that, so we can work with the school to do a rapid response and stop transmission.
Yeah, thank you so much, Dr. Kim. Unfortunately, we have a lot of questions to go, so we're obviously not going to be able to get to everyone's questions. But Dr. Davis, I have a few questions I just want to try to get answered about workers and sort of workers' rights during this post-surge phase. The first question, can work stop me from wearing a mask while on the clock? I work in retail and my manager isn't happy that I want to keep wearing a mask.
No, workers can wear masks if they want to, and there's actually regulation from Cal OSHA that says there can be no retaliation. There can't be anything that restricts a worker from wearing it. So yes, you can still wear a mask, or that worker can still wear a mask if they choose to, and the workplace doesn't require it already.
Yeah, another good question is, where can I report a violation? So either a violation around my right to wear a mask. I'm not, I know that workplaces are supposed to now give me a respirator mask because masking is optional at my work site, but my employer is not providing us with any masks at all. Another person wrote in saying, I think there was an outbreak at my work site. I don't think it got reported. So could you tell folks what to do if they want to report?
Yeah, great question. And we still do take reports of complaints of workplaces where it may be unsafe or they're not following the requirements. And you can call 888-700-9995. Again, 888-700-9995. That's open Monday through Friday from 8 a.m. to 5 p.m. You can also go onto our website, and there is a place on our COVID page in terms of filing a complaint. You can file it online. And again, these are anonymous complaints. Our team will take it and follow up as needed in terms of providing information or clarification, to the business that is having an issue or potentially having an issue.
Yeah, and I want to thank everyone for sending in these great questions and for participating with us tonight. I also want to thank our panelists. I'm going to give everyone, sort of a very short few seconds to close us out. I'll start, Dr. Kim, with you, and then we'll just go down to the end in reverse order in some ways of our opening, so people can just say goodnight.
Thank you, Dr. Ferrer. I just wanted to end by thanking everyone that has helped keep our schools open and safe over these past 2 years, these long years. This includes the teachers, the nurses, the medical directors, all the administrative and support staff, as well as our students and families. This virus has been so unpredictable, and we've really needed to change our protocols to respond in the safest way. So you've had to deal with a lot of changes, and I just want to thank you for being nimble and being responsive and really trusting in public health. We have 1.4 million students that are in school, and that is incredible. And without your support, that couldn't have happened. So thank you very much.
Thank you, Dr. Kim. Dr. Korean?
Sure. I just want to thank everyone who joined us tonight, especially for just staying curious and interested and engaged about what's happening with this pandemic and really taking the time to ask questions and get educated about what's happening here. Also, just want to say that, we're in a really exciting new phase of the pandemic with therapeutics. So if you qualify, if you are at high risk, have a compromised immune system, talk to your doctor about Evusheld. If you are infected and again at high risk, talk to your doctor, test early, and talk to your doctor about therapeutic options. Thank you.
Thank you so much, Dr. Korean. Dr. Terashita?
Yeah, I want to echo Dr. Curran. Thank you, everyone. The good news is that the numbers are decreasing, but we do need to remain prepared for small increases throughout next year or maybe longer. Thanks for standing with us. We really try to lead and be there for you with science and evidence-based healthcare care, and we, thank you for all your support.
Thank you, Dr. Terashita. Dr. Davis?
Thanks, everyone, and who's participated, submitted questions, also to all of our panelists for giving information and answering questions. I want to say that as we go through this, we are still all protecting each other and protecting ourselves. And please don't understand that if it's a strong recommendation, it's something to do. I know people are used to us requiring things, but before this pandemic, when we gave strong recommendations or even recommendations, people understood that there were things that should be done in order to protect themselves and protect everyone around them. So please don't take the strong recommendations lightly.
Yeah, I want to also just echo the thanks and deep appreciation to everyone who joined us tonight, but most importantly, for all you're doing to keep each other safe. We feel very blessed to be part of this community, and we look forward to talking with you again in a couple of weeks. So thanks again for joining us tonight.